Hi, I am Professor Dr. Kavita, Triple College of Nursing, Chennai. This video will help you to understand about ambulatory devices. Some of the objectives which are being framed to cover in this video are, at the end of this lecture, students will be able to know the meaning of ambulatory devices, list the purposes of ambulatory devices, explain the various ambulatory devices, discuss the use of crutches, and demonstrate the use of crutch in different gait patterns. And they also know about the cane and its use and how to use the walkers in the clinical area to mobilize patients. These are some of the major objectives that are being framed to cover in this video. So let us go into the content. So first we'll look into the meaning of ambulatory devices. Ambulatory devices are any device which are designed to assist walking and improve the mobility of people, those who have difficulty in walking, or people who cannot walk independently due to any trauma, injury, illness, or some kind of deformities. Some of the purposes of using the ambulatory devices are increase area of support or base of support so that the patient will have the good balance when walking. And they are also able to maintain center of gravity over supported area. And ambulatory devices redistribute weight-bearing area by decreasing force on injured or inflamed part of the body or the limb. And it also acts as a compensation for the weak muscles. And it decreases the pain by supporting the muscle groups. Improve balance, as we said earlier, the center of gravity will be supported so that balance will be improved. And it improves the proprioception, that is the sensory perception. And we'll discuss about the different types of devices. Commonly, there are three major ambulatory devices used in the clinical field are, the first one is the walker, next is the cane or stick, and next is the crutches. These are the commonly used ambulatory devices in the clinical field. So let us go into the discussion about crutches. And crutches are the devices which are used to reduce weight bearing on one or both legs. And it also gives support where balance is impaired and strength is inadequate. Usually we use a pair of crutches in mobilizing the patient. So there are different types of crutches nowadays available are axillary crutches, or we call it as the underarm crutches, elbow or loft stance crutches, and third one is the forearm crutches. The other name for forearm support crutch is the gutter crutches. How do you prepare the patient for crutch walking? So before starting the crutch walking, the arm muscles and the hand grip must be assessed, and it should be strengthened before using the crutch, and the patient is able to walk. And the leg strength and mobility of both the legs also should be assessed, and certain exercises can be done to strengthen the leg muscles. And the balance. Sitting and the standing balance must be tested, and the patient should be demonstrated appropriate crutch walking according to the patient's certain requirement. That is the part of the body affected, the patient's ability to bear the weight and their center of gravity. And when the first time the patient is using the crutches to stand or walk, patient should have an support either by the physiotherapist or other medical team members. And usually there are two types of weight bearing, that is non-weight bearing, where the patient will not able to put weight on their legs. And this here, it forms the triangular base with the help of the crutch, where the patient stands by placing the crutch in front of the legs. So this forms the triangular base, which we call it as the tripod position. And next one is the partial weight bearing, where the crutches and the affected leg are taken forward and put down together. A weight is then taken through crutches and the affected leg, while the unaffected leg is brought through. Here, majority of the weight is borne by the unaffected leg first. Then the crutch as well as the affected leg will be moved forward. So this is the two types of weight bearing. There is non-weight bearing walking and the partial weight bearing. Next, we'll see the crutch gates. The crutch gait is the gait a person assumes on crutches by alternating body weight on one or both the legs and crutches. There are different types of crutch gaits. Commonly, we use 5 standard crutch gaits, which are 4-point gait, 3-point gait, 2-point gait, swing to gait, swing through gait. So let us discuss in detail about each of these gait patterns. First, we'll see the 4-point gait. This 4-point gait is the most common and elementary and most safest gait, where it provides at least 3 points of support at all times, but it requires coordination between the legs and the crutches. The gait pattern for 4-point gait, the patient should be taught to move the right crutch ahead a suitable distance, that is 10 to 15 centimeter. Then move the left foot, then move the left crutch, then the right foot forward. That is right foot. First, the person has to move the right crutch, then the left foot, then the left crutch, then the right foot. That is alternating the crutch as well as the leg. This is the 4-point. Both crutch, both legs will act as the 4-point in moving one after the other. So just have a look of the 4-point gait. Here the person is moving the crutch, then the leg, then the other crutch and the other leg. This is the 4-point gait. The next gait pattern is the 3-point gait. To use this 3-point gait, the patient must be able to bear the entire body weight on the unaffected leg. When the unaffected leg is strong enough to support the whole body weight, then the 3-point gait will be most preferable one. Here, 2 crutches and the unaffected leg will bear the weight alternatively, and the affected leg will not have any weight bearing activity. To start with this 3-point gait, the patient should move both the crutches and the weaker leg forward, then move the stronger leg forward. That is, move the both crutches and the weaker leg forward, then move the stronger leg forward. Let us have a look at the 3-point gait. See, here 2 crutches and the unaffected leg is moved forward. Next, we'll see about the 2-point gait. Here, the patient must move the left crutch and the right foot forward together. Then move the right crutch and the left foot ahead together. That is, alternating crutch and the leg will be brought forward together. Then the other crutch and the other leg will be brought together. That is, left crutch, right foot together, then the right crutch and the left foot together. The opposite side of the leg and the crutch will be brought forward together. Next is the swing to gait. The swing gaits are used by clients with the paralysis of the legs and the hip, where both crutches will be moved forward, then lift the body weight by arms and swing to the level of the crutch. That is, you have to move the crutch forward, then bring our body weight at the level of the crutch. That is the swing to gait. So just have a look at the swing to gait. Here both crutches are brought forward, followed by leg will be brought at the level of the crutch. That is the swing to gait. The gait is the swing through gait. Here, the patient has to move both crutches forward together, then lift the body weight by arms and swing through and beyond the crutch. That is bringing the crutch forward, then bringing the legs beyond the crutch. It is similar like jumping in front of the crutch. Next, we'll see how to use crutch in ascending the steps. When the patient wants to climb the staircases, this type of gait pattern can be used, where the patient has to stand at the floor by stabilizing the balance. Once the patient is stable, then step up with the unaffected leg. Then affected leg and the crutch will remain behind. Once the person climbs one step with the unaffected leg, then bring the crutch and the affected leg simultaneously up to the step. Repeat the sequence until the stop of the staircase is reached. That is the simple thing to remember in ascending the steps is the good. Always climb first with the unaffected leg. After that, bring the affected leg and crutches over the step. Just have a look. Here the person is holding the crutch. The unaffected or good limb is brought upward. Then the crutch and the affected leg will be climbed. And the descending steps. The gait pattern used in descending the steps is just opposite to the ascending the steps. Here, the unaffected leg will remain behind. That is, the person will lead with the crutch and the affected leg to step down from the step or the curb. Once that affected leg is down, then the person will bring the unaffected leg. That is down with the pad. That is the thing we have to remember. That is, here you can see the person is standing, then the unaffected leg is remaining at the back, affected leg and the crutch is climbed down, then the person is bringing the unaffected leg. Then you have to follow with the affected leg and the crutch down, then the unaffected leg. This is the thing. So we have to always remember, when we climb the stairs, good leg should come forward. When we climb down the stair, we have to bring the affected leg and the crutch forward. The next type of ambulatory device is the cane or stick. Cane is the handheld ambulatory device. It is commonly made up of wood or the aluminium. There are three types of canes are commonly used: standard straight leg cane, tripod or crab cane, where it has the 3 feet, quad cane, which has the 4 feet and provides the most support. And this is the standard cane, and this is the tripod cane, and this is the quadruped cane. And always this cane tip should be rubber cap so that the slipping will be avoided. The standard length of the cane is 91 centimeter. Sometimes this aluminium canes can be adjusted from 56 to 97 centimeter according to the requirement of the patient. So let us see how to walk with a cane. Whenever the patient wants to walk with a cane, hold the cane with the hand on the stronger side of the body. So there will be a maximum support will be available when the patient is walking. Always position the tip of the standard cane about 15 centimeter to the side and 15 centimeter in front of the near foot, so that elbow will be slightly flexed to provide the possible balance. Move the cane and the weaker leg forward at the same time. while the weight is being borne by the stronger leg. Then move the stronger leg forward, where the weight will be borne by the cane and the weaker leg. So the cane will act as a support for the weaker leg, and the cane and the weaker leg will hold the body weight together. And when the patient is moving forward, the stronger leg will hold the body weight. The stronger leg and the weaker leg and the crutch will be holding the body weight alternatively. So here we can see how this lady is using the cane. That is, cane and the affected leg is brought forward, then the stronger leg is brought forward. This is the method we have to follow in using the cane. This picture shows the correct size of the using cane. Actually, if you look at this, the cane should be at the level of the elbow. So when the person is using the cane, the elbow will be slightly flexed. And here, if the person is too tall or the cane is too tall, elbow will be flexed more, which will not support the patient body weight, and the patient will not feel comfort. Similarly, if the cane is too short, the person has to bend backward to provide the support. And these two positions are not recommended in using the cane, while this is the correct length of the cane. So whenever we provide cane to the patient, we have to observe whether the cane is suitable to that person's height. The third type of ambulatory device is the walker. And these are mechanical devices for ambulatory clients who need more support than a cane or the crutch can provide. Usually, a standard type of walker is made up of polished aluminium. It has 4 legs and the plastic hand grip to hold it. And this also most of the time can be adjusted according to the height of the patient. Let us see how to walk with the walkers. And here we have to move the walker ahead, that is 15 centimeter in front of the body, while body weight is borne by the legs. Then move the right foot up to the walker, while the body weight is borne by the left leg and both the arm. Next, move the left foot up to the right foot, while the body weight is borne by the right leg and the both the arms. So this is the way you have to move the walker first, then move right leg, then move the left leg. So these are the 3 types of ambulatory devices commonly used in providing ambulatory support to the patient. To conclude this video, the use of assistive or ambulatory devices in orthopedics is a cornerstone in maintaining mobility in patients with temporary or permanent weight-bearing restrictions. Understanding various gait types with ambulatory aids helps in proper usage. As nurses, we must be having a thorough understanding of using and different gait patterns and the ambulatory devices, so that we'll be able to provide a good care to the patient and able to maintain a ambulatory balance. So these are some of the references made to cover the content in this video. Thank you.